let me tell you, the most common implant size that I use is dependent on the size of the person's body, right? Someone with a broader chest needs a wider implant, and so we will use a wider implant, but that means a wider implant radius, right? So the wider the implant, the greater the volume. And then there's projection. How tall is the implant, right? There's a low projecting, medium, and high projecting. So that's going to determine the volume. Most of the patients that see me want a plausibly natural look. So in my practice, the most common size I'm going to use is in the mid-2s, occasionally to the mid-3s, and the difference in that is less than a centimeter. I typically am using the mini projection, occasionally a demi, and never the full. I just don't have people coming to me wanting to look as artificial and projected as that. And that's okay if they do. I value and respect anyone's desires and preferences. But I'm in an echo chamber of people that want to be able to button up their shirt and wear normal clothes and buy bras off the rack, and they want a long-lasting result. And in reality, when you use a slightly smaller implant, you have less weight pulling on the breast, and you get less acceleration of aging due to the weight of the breast. Makes sense, right? So most people who see me are pretty healthy, and they want to be a small C. Occasionally, they want to be a large B. Very rarely, they want to be a D or greater. So for my population, I'm typically mid-2s to mid-3s max, really just depending on the width of their chest. I hope that helps. Call me if you want to talk about it. We'll meet in person and we can see what's the right fit for you.